Good evening, everyone. I'm used to saying good morning, so this is a little different. But today, I'm actually floated up to the ICU, and I'm working here with them for the third night, and I'll be working here for the next week or two because we decreased and canceled elective cases because our hospital is full of COVID. So they asked if any CRNAs would be willing to float and help out on the units around the hospital, and I volunteered to float. So it is nighttime outside. I'm getting used to this new schedule again that I used to do all the time. I just got here. I'm about to clock in and go see what I'm doing tonight. So the other night I started IVs and did Met team around the hospital, just helped out. And then last night I actually took an assignment. And then tonight, I'm not sure what I'm doing yet. So I'm about to go find out. I'm really up for anything, and I will explain more about this in just a little bit. I'm about 2 hours into my shift, and I wanted to update you really fast and let you know what I'm doing tonight. So I did get an assignment of one patient. They basically gave me like the simplest patient on the unit, relatively speaking, because it is the ICU. And the reason they did that is so I could help out with other stuff around the unit and also on the floors. If the Met team, the medical emergency team, gets busy, I can help them as well. So it'd be easy for me to have somebody cover my patient if I need to do something else. So that's where we're at tonight, kind of similar to what I've been doing the past few nights, and I've been enjoying that. So I'll have to update you on what I actually end up doing throughout the night because things change quickly. But for now, I'm just running down to the lab to get swabs because we ran out of nasopharyngeal swabs and our tube system's down. So I'm running down to grab some, and then I'm gonna head right back up to the unit and see what I can get into up there. If you are an OG subscriber, you're going to remember this room I'm about to show. Because I filmed many clips in here as an SRNA when I was working in the ICU, but now I'm in here getting IV supplies because I'm about to go start some IVs. Let's see, we'll get a 20. We'll get a 22 just for good measure, but hopefully we don't need that one. And we will get an 18 in case they have great veins, which is doubtful, but you never know. Got that. Got my IV kit, and I'm ready. Right now, I'm headed to the floor to start some IVs, actually to the intermediate care unit. I'm going to start 2 IVs and help them out because they have some hard stick patients and they're really busy over there. The reason I'm angling the camera up at the ceiling is because I realized my scrub logo is like in all my clips. I'm gonna have to blur it out because I can't show the hospital logo in my videos, or I choose not to anyway. So I'm heading to help them out. I'll see what else they need while I'm over there. Sometimes they need like labs or something like that, and sometimes they're too busy to get them, or sometimes the patients just need ultrasound because they're a hard stick. Whenever I see baby cribs, I think they're so cute, but also so sad because no little baby or child should have to be sick. Well, nobody should have to be sick, but especially not children. And I hope that all the kids get out of here soon. I wanted to talk to you guys for a second. I'm sitting in the stairwell because there's like, the hospital's like chaos. There's nowhere to vlog right now. But I figured I would just sit in here and talk to you for a second because I just wanted to have a little chat. Sorry, it's a little echoey. It's also a little dark, so the quality's not great. But COVID is like insane, you guys. I know that most people watching this are in healthcare and know that, but I'm just like shocked by working in the ICU because when I was doing anesthesia, I do come up and intubate the COVID patients, and I totally understand how fast things change, but now I'm actually seeing it for whole shifts and several days in a row, and it is heartbreaking. It is devastating. People are going from talking and in less than 24 hours, intubated and coding and dying. It is just crazy. COVID's coming in, COVID's going to ICU, there's no beds. The nurses are just burnt out because all they're seeing is death and suffering, and it's just so sad. So I just wanted to talk about that and how serious the disease is. I'm thankful for the vaccine coming out because it's looking promising. A lot of people are getting it who I've been talking to. And yeah, it's just like rough, and I feel for all these ICU nurses and floor nurses and respiratory therapists and everybody in healthcare who's been working the floors with the COVID patients day in and day out and just seeing this because it's a lot, and it's a lot to deal with, and the patients are busy and the work is hard. So shout out to everybody who's been working COVID this whole time. Hang in there. I hope it's over soon, and I will update you guys in a little bit. I'm about to start an A-line and a new admission we just got, so I'm gathering my supplies, able to utilize my anesthesia skills up here while also helping with the RN skills. So my patient is not super busy, so I'm doing a lot of stuff helping out for others. So I'm going to show you what I'm going to grab out of the supply room. Okay, so I'm going to grab some radio arrow catheters. These are what we use to put in the A-lines, the radio ones. And then I'm going to grab the ultrasound. probably won't use this if I don't need it, but I like to take it anyway, just so that I always have it outside the room in case I need it. And then all the rest of the stuff, sterile gloves, all that stuff is already in the room. So let's go get that started. I survived! Woo-hoo-hoo. So it's time to go home, and when I get there, I'm gonna talk to you guys about my pay, because that's like the hot topic. Everybody wants to know if I'm getting paid the same as a CRNA while working in the ICU, and also about how it's working, why we're floating, all that great stuff. So I'll explain that all to you when I get home after I walk the dogs. It is 10 a.m. I have this problem where I stay up after I get home from night shift, or anytime I'm really tired and start doing random things around the house, and that is what just happened. I decided to clear off my computer desktop and back up my hard drive. Don't know what's happening, but I'm looking really good, so that's a plus. Wearing Jon's t-shirt, shout out Jon, and got my glasses on. Took a shower because I can't be spreading like germs all over my house, but I'm just gonna sit here wrapped in this blanket, close out my vlog, and then I'm probably gonna like pass out. So Jon's at work and B's at daycare. Anyways, I wanted to tell you guys more about floating as a CRNA to the ICU, and also answer some of your most frequent questions, because I got tons of DMs on Instagram after I posted about this with people asking questions, and they were really good questions, so I wanted to answer them for you. So I might be repeating a little bit of what I said earlier in the video, but I want to make sure this is very thorough. Okay, so floating was optional. It was not mandatory. So what happened was we canceled electives, and they asked us if we want to float or if we want to be called off and stay home and use PTO. As you know, I am per diem, so I don't have PTO. So my option was to float or to be called off. Well, I opted to float, and even if I did have PTO, I probably would have opted to float anyway. Some of the CRNAs got to stay in the OR. We're taking turns doing that. Since I'm per diem, I'm like the lowest on that list, so I won't be in that rotation for a while. And then some CRNAs took a little bit of time off. Canceling the electives has only been going on for a week, and before that we did decrease them, but our hospital is getting to capacity, so we've had to really cut them back. I have a feeling that we'll be getting back into the OR and into the normal swing of things soon, because our inpatient number of COVID has gone down a little bit over the past week, but we'll see what happens. So all I know is that for this past week and this coming up week, I'll be working in the ICU. Now let's talk a little bit about my scope of practice in the ICU. So I am still a CRNA that floated to the ICU, so I can still do things that a CRNA can do, but I am working to help the RNs. So I'm taking a patient assignment if that's what they need. If they need me to just run around and help with things, manage patients, that is what I'm there for. I've been walking around the hospital starting IVs and lines on hard to stick patients. I've started A lines. I have not intubated anybody in this role because it hasn't been needed. I have not been working in the acute care nurse practitioner role, which is a possibility for CRNAs. We can do that, but that's not what has been needed. What they really needed is people on the floor and at the bedside, so that's what I've been doing. If what they needed was me to manage patients and work in more of an NP role, I would be happy to do that. But I'm also happy to work back in my ICU RN role because I've kind of missed that a little bit. Not enough to go back to it full time, but I have missed it a little. The second most common question I got was, am I getting paid the same that I am as a CRNA? And yes, I am. Sorry if this video is shaky because I'm holding the camera, my arm's getting tired and I didn't feel like setting up the tripod. But anyways, yes, I'm getting paid the same I am as a CRNA. My pay does not change because I'm just floating. I'm not working in a whole different role. And I'm also, we're getting a bonus throughout the hospital for working COVID. So that's everybody, not just me, not just CRNAs. And lastly, I just wanted to say that no matter what role I'm in or where I floated to, no work is beneath you. You're not above anything just because you went back to school and got a higher degree or got a different title. If I'm a CRNA, I can still do CNA work, I can still do RN work, I'm still a nurse. I understand I have a higher skill set that may be needed, but if that is not needed and what is needed is RN work and I'm not utilizing my full scope of practice, that's okay. That's okay if that's what they need. But if they needed me to utilize my full scope of practice and put in lines and go around intubating people, I'll be there for that too. So I just wanted to say that because a lot of people were commenting and worried that I wasn't utilizing my full scope of practice. Well, every day you don't utilize your full scope of practice. Just saying, your role varies, your scope of practice varies depending on what the patients need, and that's just that situation that I'm in right now. And I should probably wrap this up because A, I'm looking rough AF, and B, I'm rambling because I'm post-night shift. So
Thank you guys for watching. I hope you enjoyed this video, found it informative. If people are floating around your hospital, let me know how that's going and what they're up to. If you like this video, give it a thumbs up. Subscribe so you don't miss any more, and I will see you next week.